One of the things that you forgot about the pelvic floor is that your pelvic floor is a muscle that is 100% against gravity. And with time, you are losing muscle bulk. With time, your hormones are decreasing, and it's harder to keep that seal to keep your pelvic floor strong and tight. So the way we fix that is you practice doing pelvic floor squeezes, which we call Kegels, which are named for Dr. Arnold Kegel from the 1950s. You could call it Kegel's pelvic floor squeezes, but you just have to lie on your back, knees bent, and think about drawing in your pelvic floor. That is the basic Kegel. Now you'll see lots of creators on this app showing you different exercises that increase pelvic floor strength. For instance, a mini trampoline. Yes, a mini trampoline will strengthen your pelvic floor. There are lots of other exercises that engage your pelvic floor. However, I do believe if you don't practice isolating, how are you ever going to use it? Because some of the other muscles nearby overcompensate. I do have my patients do those other exercises once I know that they can isolate their pelvic floor. And remember, I never want you to practice your pelvic floor exercises while you are urinating, because then you are teaching your bladder bad habits to start and stop your urine stream when you're urinating, and we don't want that. We don't want that. So if you're going to the gym, after you're done working out, lay down, lay on your back. Do 10 squeezes, try to hold 5 seconds, and make sure you relax in between and take a breath. Breathing is very important. So don't hold your breath and don't bear down, because then that pressure pushes your pelvic floor and it can cause prolapse. And I want the pelvic floor to engage, and it's a drawing in maneuver, okay? Drawing in. So you're gonna take a breath in, blow out, and as you're exhaling, you're drawing in. As you're exhaling, pushing all that air out, engaging your abdominals. Your pelvic floor and abdominals are best friends. They are synergists. They will fire together. Don't make it complex. Just be consistent. It doesn't take profound things. It takes consistency. And you won't see results for months from your pelvic floor squeezes. And then at that point, you will even question, well, it's working, but it will. It just takes consistency. It's the most boring exercise ever. Because I could be doing it right now and you don't know, because you can't see and there's no feedback. And so you're like, am I doing it? Am I doing it right? And if you still don't know, go see a women's health physical therapist, and a pelvic floor physical therapist will show you how to contract it properly. Your insurance covers physical therapy for the pelvic floor. Hit the plus sign and follow for more women's health and wellness tips. Bye.